While we would like to believe all students want to arrive to each clinical day on time, in uniform, and prepared, sadly, that doesn't always happen. Life as we know it does happen, and sometimes things do get in the way of our ability to be on time and prepared. However, I've compiled a list of some of the more common red flag warnings that students may be waiving. This is not intended to be an exhaustive list. It's important to review the clinical evaluation to ensure that you understand the appropriate behaviors for the rotation. However, some red flags are not specifically written on each evaluation. Some behaviors are noted in the student handbook. Here are some. The student is unprepared for practice. Maybe they're not prepared to give medications, or they have not prepared a plan of care or a care map. They may not have arrived in proper uniform, or they may appear unkept, or their uniform is dirty or wrinkled. Specifically, look to the school policy. In the area of time management, maybe they're late to the clinical agency. Maybe with their care they're late, or they have improper timing of the procedures or the care they're supposed to render, and again, about medications. Here's a frequent example. A student arrives late on the first clinical day of the clinical rotation, so what do? Well, here's my suggestion. Make a note of it and then discuss it immediately with the student, or maybe it has to be after pre-conference. Maybe you also need to make a general announcement to the entire group, followed with a brief private conversation with the student or students. This sets the tone for the entire rotation, hopefully, preventing any further action that you need to take. Don't wait. In the area of communication or lack of communication, there's something called hedging. We know this term, but in dealing with students, the student's not able to explain why a patient is receiving some aspect of their care. Kahn and Stabler-Haas describe this as the student's inability to give a clear answer as to why a patient is receiving care, or maybe the warning signs to look for. If this is the case, then how can the student adequately evaluate a patient's care or procedure? The student is most likely unsafe. In another area of communication, it might be that the student is not reporting patient care issues such as abnormal vital signs, and I talk more about this in the next module. Or is the student forgetful, or are they unable to recognize appropriate care or evaluate the care or the patient's condition? Maybe their communication is inappropriate or disrespectful. What about errors in omission? Errors in patient care. They do things that they don't report, or they do not report the things they do. Or maybe they're performing skills or procedures without appropriate supervision. I once found a student attempting to administer triple IV antibiotics to a patient without any supervision, and most specifically without my supervision. And when I happened to find her in the midst of attempting to figure it all out, I was shocked and even more taken aback when I saw how she was attempting to do it. Not by any method I've ever seen before, or that she could have ever been taught. And she admitted that she didn't know how to do it and was just attempting to do it on her own. And the scariest part was, this was not the first attempt. This was not the first antibiotic of the triple that she was administering. Her explanation was something like, I need to figure these things out on my own. I should have responded with asking her a question like, well, where do you think would be a good place to start figuring out these things? And, in my mind, I would be thinking a procedure manual, or specifically, she should have learned this in the skills lab. But honestly, I was so speechless. I was so shocked at my finding her standing there entwined in all of the IV piggyback secondary lines and attempting to program the pump Oh, it was a scary situation. Any or all of these concerns may initiate a clinical warning. Be prepared by the instructor and delivered to the student. Should you feel a student needs to be given a clinical warning, it would be in the best interest of all parties to go forward with the warning sooner rather than later. Discuss your concerns with the student immediately, though, before any official clinical warning. Do not wait. You want to make sure that you give that frequent feedback before this becomes a habit. Look to the policies and procedures of the School of Nursing for your guidelines and then follow the procedures, as well as any particulars that you specifically may have communicated with your students through the written expectations for the clinical rotation. Discuss your concerns as soon as possible with the clinical coordinator or the lead instructor and ask for guidance. And lastly, trust yourself. If something just doesn't seem right, you are most likely right. If you feel uncomfortable with a student's performance, then this student may need more attention. You may need to spend more time reflecting, though, about why you're feeling uneasy. Maybe you have directly observed the student and you know that they need more time with you or with the instructor in the skills lab. Maybe you can't seem to find the student, so are they avoiding you? Have you asked them to contact you and they haven't followed your instructions? Or do they make excuses? Only you can answer these questions. In the next video clip, you'll hear from a novice instructor about her feelings in delivering a clinical warning.